Guys, well, welcome back to the main room. This is just a COVID-19 update about vaccines and what you really need to know. Disclaimer, I'm not an epidemiologist or an infectious disease doctor, but I am a pediatric rheumatologist, as you guys know, and care a lot about my patients, and all of this is just science. So no politics, this is all science. All right, so what is COVID-19? So it's a little confusing. SARS-CoV-2 is actually, the severe acute respiratory syndrome coronavirus is the full name for that. And that's actually the virus. And this is a beautiful diagram of it where it's not beautiful when you actually have it. And then COVID-19, when we say COVID-19, that's usually the syndrome. So the viral symptoms, et cetera. So that's just the difference between what those two nomenclatures are. What is a coronavirus? It's an mRNA virus, and in humans, it can cause two types of disease. It can cause a more common cold with headache, fever, sore throat, runny nose. But then what we've been seeing more recently is the other type of disease it can cause in humans, which is emerging infection. And this is where it is escalated to a pandemic. And this includes some of those prior symptoms, but now also fevers, dry cough, breathing difficulties, GI issues, diarrhea, etc. And there's different spectrums of this. There's mild to severe. Severe can lead to pneumonia, kidney failure, ICU admissions, intubation, and even death. So in kids, this is a publication in Pediatrics from a few months ago. These are just general percentages. In the essence of time, I'm not going to go over each, but you can see the majority have these kind of more typical common cold symptoms, but fever is also prevalent. Cough is in only about half of them, but there are a fair amount of children, maybe 30% or so, that actually have no symptoms at all. But these are the more common symptoms that they've noticed when looking at just healthy children in general that get COVID-19. How does the virus spread? Basically, this is someone sneezing or coughing, and it can travel up to at least 6 feet. And the droplets land in the eyes, nose, and mouth, and that's how the virus gets, into the host, etc. There is some contact spread, but it's very, 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 very low compared to the droplet spread. This is just an example of how COVID-19 can spread very quickly. This was in last summer of 2020 when there were some precautions, but things were lifted in Georgia. They asked the staff to wear masks, but not the campers. And all the campers and staff going into camp were COVID negative testing. But by the time camp was in full swing, some of those asymptomatic people that didn't turn positive just yet flipped over positive, and 44% of the campers were positive. So these are the kids not wearing masks or socially isolating. So this is just an example of that difference. So the top in blue is using socially distancing. This is not even adding the masks on top of that. This is just social distancing. And the more green on the bottom is normal contact without social distancing. So you can see how in 5 days, 1.25 versus 2.5 people are affected. But then the bigger difference is in 30 days, doing that social distancing, that one person that was infected can infect 15, but that one person that was infected that had no social distancing actually ended up infecting 400 people. So there's a huge benefit from just social distancing alone. Now, what about masks? They also work. This was just a small experiment asking people to say 5 times in a row, stay healthy people, with different types of masks. And then you can see that on the bottom of the screen, the surgical mask, cotton mask, etc. The bandanas didn't really seem to do that well. So maybe kind of shy away from those. But the rest of the variety of masks work quite well. And compared to no mask, the droplet count was much higher. And then I guess like there's some type of fleece covering that doesn't work as well. So those two measures, those two measures of social distancing and wearing a mask definitely help decrease the spread very, very much so. So this is just a lot of you obviously have children with rheumatic disease. So wanted to give a little bit of data, but it would take 3 hours for me to share all of the data, but a little bit of data, and this is new, just published about a month ago, of kids with autoimmune disease. So this was taken from Emory. And these were kids with rheumatic conditions, 55 children. and they had confirmed COVID-19. So it could be outpatient, inpatient, just anyone that had COVID-19. Most of them had juvenile idiopathic arthritis, followed by lupus and dermatomyositis. I have to look back in the article to see if there are any systemic sclerosis, but I honestly doubt it, just because, as Dr. Moore was saying, it's like in kids, it's actually only like about 1 in a million that have systemic sclerosis. But they had similar symptoms to the general population. 18% were hospitalized. This is they're thinking this may be a little bit of overestimation. Other papers that we've read are around 10% or so, but still about 10% or so did get hospitalized. The ones that had a more severe course were African Americans, those with any kind of heart involvement, if they had active rheumatic disease, if they're on medium or high dose of steroids, and if they're on mycophenolate mofetil or rituximab. And then, a lot of people might be saying, oh, my kid is on this, but I would not shy away, like, please keep the medications going. This is like a combination of things that may be potential risk factors, and this is a low number, 55 patients. In our clinical practice, we actually saw more patients flare of their disease off of medication. So please, like, keep your medications going and just talk to your rheumatologist. If your child has a positive COVID-19 test, definitely just call the rheumatology office, let us know that, and we can help give some guidance specifically for your child that is on our medications, et cetera. So how does the COVID vaccine work? So basically the Moderna and Pfizer are the ones that have the mRNA technology. So what that is basically they're stabilized by fat molecules. They get that into the vaccine. And then you get the vaccine, and basically these are supplying instructions to your cells to make spike protein. So this is how it kind of prompts your immune system so that you're ready to fight the infection when you encounter it in real life. So you're mounting this response, but then the mRNA, it degrades over 72 hours. So all those things on social media about potential fertility issues, like years down the road, are not scientifically sound at all. The mRNA is gone. It's out of your body within 3 days. So there's no way it can affect like ovaries or any kind of thing like sperm way down the road. So I just wanted to make sure that that is debunked here. And how are vaccines developed? Again, I feel like a lot of my patients that are hesitant against the vaccine tell me it's because this was a rushed process, and that's actually not accurate. Any vaccine, including the corona vaccine, went through multiple phases. So phase 1, you're just trying to see, is the vaccine safe in a small group of patients. Phase 2 is the vaccine safe in hundreds of volunteers. Phase 3, is the vaccine safe and effective? Did it actually do what it's supposed to do? So that's the phase 3 part of the trial. So FDA will not license the vaccine if it is not safe and effective, and the benefits have to outweigh the risks. So all of these steps were made. And then after that clinical trial part that I was showing you, that's just phase 1, 2, and 3, we've got lots more steps until it gets to the public. There has to be a board, advisory board, that reviews everything that went on with the clinical trial. The FDA has to review it and approve it. Then there's an advisory committee on immunization practice that has to also review and approve. The CDC has to review and approve. Then it gets released to the public. So there were multiple steps behind the scenes that were going on. And yes, the COVID vaccine did get emergency use authorization, but all of that means, honestly, is in the phase 3 trial. They had to prove safety, but the efficacy was proven, but the efficacy data was not distributed to the public just yet. That was the only kind of change in an emergency use authorization. The quality, consistency, everything was all to par. And then, so the current vaccines that are out now are the Pfizer, Moderna, and Johnson & Johnson. Only the Pfizer's the 12 and older. And then the next stage is that we're waiting for, we're hoping November, the younger kid vaccines for the younger, the 5 and up. So my children are patiently awaiting that. So it really wasn't developed too quickly, as I was mentioning. But what helped it kind of move more quicker than some other vaccines is that there's actually already background, decades of research on other coronaviruses and vaccination development. The government obviously put more funding and things of that nature for scientists and researchers to like get things moving quicker with the upfront financing. And then also we had a high number of the public being infected. So that's actually where you can see efficacy quicker. So like the polio vaccine that was developed in the 1950s and 60s, it was easier to see that that was effective quicker than something that may not be as common in the population. So that's why it may seem like it came out quicker than a typical vaccine, but it's because there were some background things and some other things going on that helped launch it a little bit quicker through the process, but still had to go through the full process. So the efficacy, so that means how well does a vaccine work? So it is recommended, as I mentioned, the Pfizer one for 12 and older. Pfizer is saying that they do feel that that's 100% has efficacy in the kids 12 to 15. 91% effective in preventing severe illnesses in children 16 and older. So that's like some adults that you guys might know, like your Aunt Sally that got vaccinated, but she still then was COVID positive or got COVID, but odds are that Aunt Sally had maybe a runny nose or cough, but that she did not get hospitalized, intubated, and had severe outcome. So it's supposed to prevent that hospitalization and severe outcome. So that's kind of the summary is, you know, I would encourage anyone that has 12-year-old children and older to get the current Pfizer vaccine, and when the new vaccines roll out for the 5 and older, and when younger available as well, to get them for your children. And then, you know, one of the other obviously concerns of parents that I hear in my clinic are side effects. So these are just examples of side effects from like shingles, that's a shingles, just to kind of give you an idea of other vaccine that's been around for a while that a lot of the adult rheumatology patients get, and some of our older teens. And then these are the different coronavirus vaccines, as well as like the typical flu vaccine and placebo, just a shot of saline. So these are kind of the side effects: local pain, redness, swelling. So just kind of the shot itself. But it's on par, honestly, with the Shingrix, or a little less than the Shingrix, but not as a little more side effects just locally than the flu. And then, like, you know, a smidge of headaches, chills, fever, but that's just a day or two, and then you get better. And then, so this is just, again, supporting some pain, redness, and swelling locally, and then maybe a day or two of like tiredness, headache, etc. Especially with that second vaccine. I experienced that. It's not fun, but you go on to the next day. So the main concern that I think families have are some of the things that they've been seeing kind of passed around. So allergic reaction. It's rare to have a severe allergic reaction to any of the vaccine. This local reaction is something different. That's just swelling and pain at the vaccine site. And an allergic reaction is like the trouble breathing, kind of if you're allergic to bee stings, things like that. So that's pretty rare, 11 cases per 1 million doses. And, you know, that's why we have people sit down for 15 minutes after the vaccine and monitor, everything's fine, then they can go about their day. Blood clot was obviously one of the things that really circulated around. It was seen a little bit more with the Johnson & Johnson, but it was still rare. 7 cases per 1 million vaccinated, and in slightly, you know, young adult or older women. So this has not been seen, you know, moving forward. We've now had a year and a half of data in the real world. 187 million Americans are vaccinated at this point. So that is a ton of data, and we have not seen an increased signal over time of blood clots beyond this initial kind of report. And that heart inflammation, or myocarditis, you may have heard of, inflammation of the heart, that affected just literally 6 to 20 per 1 million vaccinated adolescent males. I know we saw one here in the ER, basically got some IV fluids and got sent home and is fine. So there's no like long-term outcome of that. It is a risk, but it's very, very low compared to the risk of actually getting coronavirus, getting sick, getting hospitalized, intubated, and poor outcomes. So we definitely would encourage the vaccination, and these are very uncommon side effects. Yeah, so this is just what I said already. 190 million Americans are already vaccinated, and the serious adverse events are very, very low compared to getting the COVID itself and the secondary issues there. And then the vaccines still are monitored. So if you hear things on the news, they're like, oh, well, now we're recommending X instead of Y. That's just because more and more data keeps coming out. It's not because something drastically different has been uncovered. So these are just kind of some myths that were discussed about the COVID-19 after receiving the vaccine. It doesn't contain live viruses. These are killed. As I said, it's degraded after 72 hours. And it's not going to change your DNA. It's not like integrating into your body and changing your DNA. It's just like all the other vaccines, just helping your body make antibodies. And I mentioned the fertility has no way that it can cause that at all. Just biologically, it doesn't make any sense. And actually, it's encouraged for pregnant women to get the vaccine. And there's no evidence that it would alter menstrual cycles for your teenage daughters, etc. So yeah, we recommend it. Talk to your rheumatologist when it would be ideal for you. It just may depend if you're starting a new medicine, things like that. So there's lots of different recommendations, and I don't have time to go over them, but I am on the medical advisory board at the Scleroderma Foundation, so happy to answer questions, etc. But there's certain guidelines that we do have out there. And just know that some of the guidelines you might read for adult rheumatology is actually slightly different for pediatric rheumatology. So definitely talk to your rheumatologist if you're unsure. I think my time's almost up. So
I was just going to say that your time is basically up. So
all right. The last
we're going to be moving to breakouts real quick. So if you want to wrap up and maybe take one question, that would be good.
Sure. So the last thing I'm just mentioning is if people have heard of MISC, it's multi-system inflammatory syndrome in children. This happens 4 to 8 weeks after the COVID infection. So your child may have almost no symptoms when they initially get the COVID infection, but this is 1 to 2 months later. They get very ill and they get hospitalized. They have heart dysfunction. They need us in rheumatology and in the ICU, et cetera, to help kind of manage with some aggressive medication. So to prevent that, that's why we keep pushing the vaccine. That was the end for that. And there's lots of different resources here. All right. So I can take a question, but I have not been paying attention to the.
There are many, many questions in the chat. So I think you'll be very busy after this.
Okay. So I don't even know where to start. There's a ton. Are one of the other docs on here that have been monitoring?
I think you could, one question is, what about the booster shots and stuff like that? Do you recommend that?
Yeah, so the boosters are recommended for all of our patients that I'm aware of, especially on any of our medications. Those are like frontline. Dr. Lee, I'm not sure what you guys have been saying in your practice, but any of our patients, I would say, would qualify for that, the booster.
Yeah, and another question, is there a risk of flare-up of the disease from the...
We have not seen that in pediatrics. It's been more heavily studied in adult rheumatology. They do have a big paper with lupus and rheumatoid arthritis in multiple centers, and they did not see any increase in flare of their autoimmune disease compared to the patients that didn't get the vaccine that have the disease as well.
Yeah, I think in the adults, there's been, some patients that have flared. This could happen similarly with other vaccines. So, this has been reported after like the measles, mumps, rubella vaccines that some people can flare. So, but it's very infrequent. And I think that the longer COVID is around, the more we realize the terrible disease manifestations that can arise from that. I think that people are really worried about brain involvement now from COVID, which is extremely difficult to study. So we know how to treat flares in our disease. We really don't know how to manage a lot of COVID problems. So still recommend the vaccine.